Yes,
Minister, before I begin, I want to thank you for your responses and indeed those of your staff working in your office. I got the responses back in relation to the questions I raised last week. And I'll begin by noting that the advisory group on the reopening of early learning and care and school-aged childcare services met last Friday, the 15th of May, and that the Department are continuing to make preparations for the phased reopening of childcare services in line with the Government's roadmap for reopening society and business. As I understand it, 6 sectorial representatives nominated by the sector participated in the group. But I'm just wondering, Minister, how is it that despite such intense collaboration and with such wide-ranging levels of consultation, that the availability of childcare services for frontline workers has still not materialised? And I'd just like to explore that question further. Many members would have been supportive of the decision to roll out that service, but it appears that a roadblock around the insurance and state indemnity has been the rock on which the scheme perished. And if that is the case, then why was there no representative from the insurance sector on the advisory board? Were they asked to participate and did they refuse to take part? It's just something I would like clarity on, Minister. From what I and other members can see, the insurance sector has been nothing but obstructive in the entire process of getting us back to normality. And not alone is that confined to the childcare sector, also in terms of businesses, they have been extremely obstructive. I've also raised that here in this House. It is absolutely outrageous that this has been allowed to continue, but having said that, it is also clear that responsibility for some of the confusion around the rollout of childcare services can be put down to the lack of communication by the Department. That is certainly the sentiment being expressed by the childcare representatives on the ground. They feel that despite the composition of the advisory group, clarity around what exactly is happening is not reaching the providers. On another matter, an entirely different matter, Minister, you might provide me with an update on the work of the school meals programme. As I understand it, your department, in conjunction with the Department of Employment Affairs and Social Protection and the Department of Education, has devised updated guidelines for 1,580 schools and organisations in the programme. Can you please tell me what has been the feedback from TUSLA Education Support Service, who I understand are communicating with all homeschool community liaison coordinators and school completion programmes on this particular issue? And my final question, Minister, relates to the family resource centres. I know that they are experiencing some pressures, some service pressures regarding funding and their wish to increase staffing levels. Could you please clarify if you've engaged with the family resource centres and outline how you propose to respond to the challenges that this sector is experiencing?
Thank you, Deputy Nolan. Minister.
Deputy, and actually, you know, your first question in relation to insurance, it's my understanding, and the insurance company in their discussions with the providers in terms of the model for potentially insuring in the homes of healthcare workers, that ultimately they decided not to do that. One of the primary reasons is because the profile of the children that would be being cared for was shifting. The profile of the children in their original or their current insurance plan are the diverse groups of kids who come into their centres. The profile of these children would be children of healthcare workers, and that's, you know, so therefore assess that the risk would be higher. That was one of the primary reasons that was offered. What I would like to focus on now, though, I think, is that with ongoing conversations, both my officials but also with the providers in relation to the insurer, is that in going back to a centre-based model, that they will be insuring, that they will provide insurance and cover in that regard. And I think that's extremely certainly helpful. In terms of your issue, some statements around the lack of communication, et cetera, what I will say is that in the last, and in terms of as we move towards the new scheme, that my department is communicating with providers directly by email. And certainly in the last week, in terms of what is happening in the planning for that scheme. So, sorry, and
Sharon.
we'll send answers to the other questions.
Minister.